Okay. So is it okay if I just sort of run through and then if anyone's got any questions, we can have them at the end?
Yep, that's fine. I can help you with facilitating the Q&A as well.
Okay, fabulous. All right, so hi everyone. My name is Nana Devere. I'm the head of productivity and efficiency at Lewisham and Greenwich NHS Trust. So my team and I, over the past 2 years, have been basically working with colleagues within the trust to increase uptake of the model health system. So we're here today just to sort of talk about that journey, share some of the successes we've had and some of the challenges we face, and then similarly, to hear from others, in terms of how or what they're doing to increase the use of the model health system portal in their trusts. So to kick things off, I like to just sort of provide some context in terms of what the focus has been in improving uptake of the model health system portal. So um, really the main focus has been on educations and specifically we've been running divisional engagement sessions on how to use the portal. And we've done this at various forums. So this is sort of like really specific to how our governance apparatus is set up in our trust. But we have forums like divisional management boards. We have forums specifically for our efficiency program, which is sort of divisionally focused. So we have sort of divisional work streams and we have steering groups for those work streams where we meet regularly. So that's another avenue or forum for us to socialize the use of the model health system portal and try and increase uptake that way. We've also run sessions specifically or for teams or directorates where we've had a request to do so on use of the portal. And the way we've approached is essentially, I don't know if people are aware of this, but NHS England have a template basically. Um, it's a set of slides with various bits of information about the portal. So we essentially take that and then we tailor it slightly. So for that specific division, we will sort of get copies of reports from the portal, include it in there, so make it relevant to them, and the essence of it basically. That's how we run these engagement sessions to educate people on how to use the portal. Um, Another sort of key area where we've had some successes in getting people to use the portal more is around improvement opportunity identification, right? Specifically around the types of opportunities that lead to efficiencies, productivity improvement. So if you're familiar with the portal, already that like on the sort of landing page of the dashboard it specifies potential improvement opportunities or productivity opportunities by specialty, and then there's actually a lot of data that sits behind that um to sort of identify the area of spend that is driving some of that opportunity. So later on I've got a slide that sort of stipulates how we go about that, um and obviously when it comes to identifying improvement opportunities, we tend to try and make it as relevant as possible to the audience that we're engaging with. So looking at things by specialty, by pod, making it as sort of looking at things to as operational a lens as possible, because obviously that makes it more relevant to the end user or to the people we're engaging with, as opposed to sort of like taking a more high level view of things, which um, it's more beneficial actually when we use the portal for planning and sort of like strategy purposes, right? So that's the sort of the other lens that we focus our improvement or uptake efforts on. Um, and that's basically doing a wider piece or sort of a nearer or long-term piece on efficiency planning. And again, the portal has a lot of information that can be accessed for these purposes, right? On a longer term basis at a higher level, to give a sense of what actually, there are some opportunities to go about. How we unlock that then becomes the focus of developing the efficiency plan. But I got some slides on this, or a slide actually, and then we can talk about that. And then another avenue that we've looked at to sort of get people to engage in and access the portal for information is project delivery and assurance. So the portal has a lot of metrics there. And a lot of these tend to be relevant when you're tracking a project to see if it's delivering the right outcomes. Because you would need performance management. So like recently we started developing like an efficiency scorecard for the trust. We have our local BI systems, but here the real value in sort of linking or using metrics in the portal, it's that we don't just look at our individual performance, but we sort of in isolation, but we can also compare it to how other trusts are performing, because performance is like at a trust level is quite relative. You don't want to sort of get a sense um that you're doing well when actually, the metric or the landscape has shifted, right? You want to be going in the same direction of travel as all other trusts nationally. So hence the value in actually linking to metrics on the portal. And again, this is another sort of a source, right, for getting people to use the portal, right, and increase in uptake. So the next slide is just a little bit more detail about like the educational and clinical engagement piece. Um, so I've sort of talked through or mentioned various aspects of what we do here in terms of organizing the workshops, tailoring what we present, so it's relevant to the audience. Um, sort of picking reports where we think would be of interest, given like the local context and the current challenges being faced by the um, sort of clinical team or division or directorate. And also what's quite key in this educational piece in terms of trying to get buy-in from the divisions or from the audience is not looking at just the variation report, right, on the model health system, but also looking at the trend line report. Because often what we get back is, well, it's these trusts are very different to us. Um, so that might explain why, they're performing better than us. But it's a much more difficult sort of argument to make when the trend with the trend line report, because it also shows you how you've performed over time. So if historically you've performed better than you're performing now, that's more difficult to argue against. So it's another way of getting people sort of bought into the value of the information on the portal and its relevance. Um, and here I also wanted to highlight or take the opportunity to highlight some of the issues we've sort of come across. And we can talk more about this actually in the last slide, but um, really key to sort of continued engagement or uptake of the portal post these educational sessions or engagement sessions is actually making sure people can access this, right? And a lot of the time that's sort of the first barrier basically, that people are not able to register. So we do try and sort of support individuals to get onto the model health system, um, like to register, and any sort of challenges they've got with registering, we try and sort of signpost or point them to the right direction or individuals who are able to help. And then the last bit is a lot of the information on the model health system, right? Is reflected in the GERF recommendations for the specific trust. So to sort of make it a bit more real, it's also sort of signposting or presenting the information or the data, right, alongside the GERF recommendations, which typically we would have teams or individuals in the trust sort of look into to address the recommendations. Um, this is just a chart to um, highlight what I personally think is the value of the trend line report. And in various conversations I've had in getting people to actually buy into the information on the portal itself, and like actively doing something with it, is to use the trend line report to just illustrate how we've performed in the past, and how we're performing now. So I think what we've got up on screen as an example is the day case rate for ENT um, procedures, and we can see like lately, we are above the benchmark metric, but historically we've been going back as far as 1920. Actually, we've been as high as 95% in terms of the day case rate for ENT. So, um, you know, if previously we've had the capability of achieving that rate of performance, although it was only for a brief period, let's sort of look at the factors back then that led to that, would be sort of one of the arguments I would make. And the point here is like, in making or encouraging uptake, it has to be relevant to people, right? Information in the portal has to be relevant. It needs to be something that they can use to make decisions locally for improvement or for other reasons. So there's actually a lot of work we've done to actually make it relevant to them. And it's just illustrating one way of that we've approached this. So the next slide was just opportunity identification, and this is again touched on this, but got some screenshots here just to illustrate how you can use information, or how we've used the information in the portal to basically narrow down the opportunity, and in turn obviously make it relevant to our stakeholders, right, who we're discussing the opportunity with. Because a lot of the time what we get back as well, the information is too high level, it's too opaque. It's not clear enough to sort of tell us the specific area where the issue is, or the steps we need to take to address the issue. But this is just to illustrate that, for Lewisham and Greenwich, as an example, we have a 17.6 million to 23.5 million opportunity in obstetrics. Obviously, there's some information missing here, but most of this opportunity actually sits in our outpatient activity for obstetrics. And looking further into the detail, we can see that actually the biggest sort of differential we've got compared to our peers, right, is in our nursing costs. And this is actually borne out in our data locally as well, rather interestingly. And this is another sort of thing that we do, is to triangulate some of the information from the portal to like local data sets we have, like service line reporting, to make it as relevant as possible. And that's an area, or with this approach, this is how we've had success in people actually logging into the portal and monitoring this information, and sort of asking questions of ourselves locally in terms of how we can unlock some of this um, efficiency or productivity gain that's been flagged. And efficiency planning. So last year, for instance, we had to create a long-term plan or efficiency plan for the trust, and the portal was one of the sources we used for that. The data from the portal went into slides that went to one of the senior finance governance forums, which is our financial oversight group forum. And then again, by presenting this data, we obviously sharing the source of the data and encouraging some of the directors actually within that forum to access the portal and to sort of acquaint themselves with the source data. But overall, we were able to tell a story in terms of the potential, what although say savings is really like a productivity and efficiency gain, the trust could stand to unlock in these various areas, and then the data that sits behind that. And here again, by taking information from the portal, presenting it in a relevant manner, it gets people to engage and gets people to use it. And then project delivery and assurance. Touched on this earlier again. So we regularly use the portal as a sort of source of reference for data on theatre utilization, both capped and uncapped, to track the progress of our theatres improvement program. Because it's all, like, again, it's all well and good tracking our local performance, but we want to see if we're improving, like how that ranks nationally. Also, this obviously the other value of the portal is that it gives you a sense of place. So where's trusts or our peers or who are local to us are performing better than us, then we can reach out to them to try and understand, like, how they run their operations, and if there's anything that we can learn and adopt locally to sort of rank similarly to them or even better. So we make regular reference to, the trust position on the portal, and that makes it part of the delivery and assurance conversations for our projects. So I've just selected like these two metrics, but there are other metrics on the portal. For instance, length of stay is another key one that we regularly look at as part of monitoring of our length of stay programs. And performance management. So this has gotten better actually recently, because obviously they've included the productivity and efficiency sort of section in the portal. But this is really useful for us as well. And it's been quite useful in getting people to access the portal to view this information. So I think most people on this call, given the audience, will probably be aware of like the implied productivity report, and that's now on the portal in the productivity and efficiency section. We get the sort of reports or slides from Managers England, but that doesn't get circulated like, sort of with enough regularity. So often make reference to the data on the portal so people can access that. And obviously it has other information on there as well, which is really useful. Um, um, and I think this next one is, I don't know if that was the length of stay, but the point being that like as part of our efficiency scorecard, actually, we make reference, or we actually link directly to reports in the portal. Um, so although the reports we produce locally provide a snapshot view, it's always encouraged that people actually directly access the information in the portal just to see how we're performing and how we rank compared to our peers. And lastly, I think it's the common challenges that we faced. Um, so I think the biggest one, which is listed first, is just people getting access to the portal. I think that has been the greatest barrier and sort of what's been fed back the most. Um, like post-session or when we engage with them, what tends to happen is like they try to access it, but then it's just being able to um, register and have access to the portal has been an issue. And there we've um, referred colleagues to the team in NHS England to sort of help them resolve these matters. I think for the most part, most people have had access to the portal or have had these access issues resolved. Um, and another question we get a lot is actually how to access certain bits of information on the portal itself, to sort of navigating and getting access. But there, myself and my team have made ourselves available for people to just um, get in touch with us so we can assist them with that. Um, and I think the biggest one as well is the pushback and challenge around the validity of the data on the portal. So really early on, we used to get a lot of this, that the information wasn't really relevant, or they thought it wasn't actually data submitted from the trust. But the diagram like to the right actually has been very helpful in terms of the various data sources. So the sort of like counter argument here is that, this is data that we've submitted onto the portal. So if it's wrong, then the action there is actually to look at the data and correct it. Because we will get measured on what we put out. So if genuinely the data is wrong, then it needs to be corrected, and the action there is to sort of get in touch with the relevant person within the trust to actually address the issue. And obviously there's been instances for one reason or the next where and it's in England, or the data on the portal actually is not representative of what's been submitted. And um, it's sort of proving point that by improving uptake, then we've actually been able to address some of these issues, right? Because we've got people cited on the information in the portal, and if it's wrong, then they'll point it out to us, and we'll take the steps to actually get that corrected. But the diagram is actually from the template I mentioned from NHS England, which we use for our engagement sessions. So it's really useful just to explain like the data flow and how it all comes together. But the key point being that it's, the data is coming from us as a trust. So it's imperative and on us to address any data quality issues with it. Um, and then the other sort of major question that we get, or the fourth one on the list, is the methodology used to calculate the metrics. And this is actually used to be another one where we used to get a lot of questions on, but um, um, rather like the portal itself has a section which explains the methodology. So rather fortuitously, right, it's all explained there. Sometimes people have some challenges understanding how the metric works, and again, we sort of make ourselves available to explain it, or if it's unclear, we will write to the support team for the portal just to get some further details on this, or reach out to like people in our network who might have a better understanding just to clarify it for us. And this is actually quite an interesting point because I think it's actually directly led to a change in how we calculate did not attend locally in the trust based on the methodology that was being used in the portal. Because I think we were counting sort of activity that was excluded. So again, proving point of using the portals to actually sort of deliver improvements locally. Um, yes, and then this sort of fifth point is obviously one which is, you know, um, a really sort of, if I can say, like a frustrating point, in that not all of the data on the portal is sort of relevant in terms of um, the current financial year or recent financial year. Some of it's quite old, going all the way back, I think, to 2021. So with that, there's very sort of little that we can um, argue. But nevertheless, we sort of tell people that it's a useful reference point to have. But obviously, its relevance for making those decisions locally in the current climate or in the current operating environment is limited. Um, and then the last point is the relevance of peer trusts. So obviously with the portal, you can select like, the different types of peers or who you want to benchmark against. And making this option clear to them has helped sort of has helped basically, sort of calm some of the concerns that people had in terms of the relevance of the peers that we were being benchmarked against, because obviously you can sort of choose or select different peers. So that is a whistle-stop tour in terms of some of the steps we've taken to increase uptake of the portal um, locally within Lewisham and Greenwich. So my team, being sort of like focused on productivity and efficiency, we tend to look at things from an efficiency and productivity lens. Um, and the portal itself has been sort of a really useful data source, I should say, in our line of work. So I will pause here and stop the presentation in case anyone has any questions.
Got a question from Lawrence.
Hi there, thanks very much. Can I just ask just a little bit about yourself, Nana, in terms of, do you work in informatics? Do you work purely or dedicated towards efficiencies in the PMO? I suppose I'm asking this purely from the point of view of, Model Hospital is fantastic. It's got probably, in the sense that it brings everything together. It's probably the best single benchmarking tool that we have. It's imperfect, but it's all we've got at the moment in terms of support, our starting point. And I suppose I'm just querying, because what it does is it shows you where to look. It doesn't give you an answer. And obviously it's combined with, you need a lot of support from your business intelligence teams in terms of going through the next stage. I'm just curious to know just a little bit about yourself in terms of, do you have an information background, and how closely informatics have worked with you in terms of enabling and embracing and supporting and pushing this in your trust?
Yeah. So I sit in a PMO, or I lead the trust efficiency PMO. I've got a dotted line to me from our costing team. So to sort of answer your question directly, I lean a lot on them to sort of bring some of this information to life. So what I didn't sort of touch on was how we used Plex data basically to um, really get underneath some of these efficiency opportunities. So we do a lot of work actually to see, for instance, where we've seen an opportunity in model health or model hospital or in my model health system, is that reflected in our data locally? Um, and for the most part, it is. So the whole sort of like concept behind the model hospital portal, right, or the benchmarking system was to eliminate unwanted variations, right, between trusts. So sort of taking that idea, the way we are set up as a trust is we have two hospital sites that, in essence, deliver the same services, right? So we are not sort of set up by clinical groups, but we have sites delivering the same services, and literally we use our Plex data to benchmark them. So we can see, for instance, in the specialties that model hospital is flagging as having these opportunities where or having disparities to other trusts, like that it's born locally within our own very own two trusts in our ways of working, right? Um, and one of the things I was able to do on that basis is actually do some analysis, all those sort of very high level and very crude, on what clinical variations were due to local variations between our two sites, right? And what was due to, like, I guess, external variations between the trusts that we are benchmarking again, making it as relevant as possible to individuals or to the operational teams locally. I would say my experience, um, as long as your data is correct, or the data that's submitted to model hospital is correct, right? There is some truth in the variations that you're seeing. There is something there in terms of an efficiency or improvement opportunity. Any further questions, or anyone wants to share this similar experiences and the work they've done locally in their trust to get people to use the model um, health portal?
Question from Jake.
Hi, Nana. Thanks for that. It's been really helpful. I was just going to ask, what's the uptake been like at your trust? Would you say you've got more clinicians using it on a more regular basis, and would you say they do it voluntarily rather than someone from the PMO kind of pushing them to do it? Are they almost
Yeah,
kind
I
of
would say it's
Yeah.
it's spotty, but it's always it's patchy basically, like in terms of uptake on the clinical side. Um, but we've had a lot of support locally from the chief executive, like all the way up to the chief executive, to try and get people to use the portal basically. So at his request, like some of the recent engagement sessions that we've run has come from his steer to try and get people. I think when it comes to clinicians, so for instance, I sit on the panel for our Get It Right first time steering group, and we have like clinical teams present to us how they're performing in terms of the recommendations, right? So that's another forum where we make reference to the model health system and where we're sort of placed there. So the clinicians do use it, but I can't say that like in the time that we've been sort of actively trying to improve uptake, um, we've seen sort of like a sea change. I know, like I said, it's a bit sort of patchy, but I have seen people make reference to it in the example I gave in the updates to the sort of get it right first time panel.
Cool. No, thank you. That was helpful. Yeah, it's just trying to get an idea of how much kind of clout and kind of resource you need to put behind it to start driving it. So that was
Yeah.
helpful. Thank you.
Yeah. I think that the ease, well, it really depends. It can be like straightforward and easy, but for us, in a sense, it's been a little bit fortuitous because our governance apparatus sort of enables that, right? So we've got like steering groups and sort of various governance forums where um, you know, like clinical teams have to present to, or the operational teams have to present to, and then like a requisite or a requirement in those forums is to sort of update on performance, right, of the changes they're working on, the improvements they're working on, making reference to sort of like where we are on model hospital. So if it's embedded in like local processes, right, then arguably people will start using it.
Okay, no, that's helpful. Thank you.
Any further questions? Have I stand everyone in silence?
Seems like that's it for questions. Thank you very much for coming today. I hope everybody found that useful. Yeah, slides will be shared along with the recording afterwards.
Yep, brilliant. And of course, if anyone wants to sort of reach out and share their experiences, any advice or got any sort of questions later on, please do get in touch.
Thank you very much.
Thanks, everyone. Bye.